Welcome everyone to another wonderful episode here at Jaws of Podiatry. Welcome everyone. Welcome. Anyways, we have a very pleasant patient who has returned to our office for, routine care. One of the clinical presentations that we do see a lot, the notorious great toe pinch callus. In this particular case, the patient has the pinch calluses as a result of her flat feet. When the patient or the individual pushes off the ground, right? When they push off the ground, all the pressure is placed on that one specific location, which is, again, a symptom. The callus or the corn is a symptom of the underlying problem. So what we want to do is, at the core, we want to treat the flat foot, right? Whether it be, changing shoe gear, orthotics over the counter versus custom molded, etc., etc., etc. But nonetheless, let's go ahead and let's take a look. Okay, so as everyone can clearly see, this is quite the corn / callus, and a lot of people, a lot of patients, when the pain becomes unbearable, what I'd like to do is perform a minimally invasive procedure. Make one, tiny little incision here, one stitch right there, and I basically just shave, or what we call saucerize the bone. And in doing so, make believe it's a bone spur. And at the core, that's the problem. The bone is there. So if we can saucerize it, remodel it, shave it, smooth it down, this goes away. So this is the symptom of the underlying problem as a result of the flat foot or the flat feet.
I mean, I figure that, but I just like to hear it.
Okay, so again, we've already applied the 3W. Very carefully. So a lot of people ask me, why don't I use a blade handle? I have more, and I've always, since the beginning of my short career, I just got used to not using the blade handle. I have more control with not using the handle than actually using it. And I really do. I think a lot of people get scared for me, and I appreciate that. They think maybe the patient's gonna jump. It's never say never. It's never really happened to me where the patient actually moved and I right? I'm sure it will eventually, possibly happen one day, maybe not. But, I've seen these calluses come back in a week. I've seen them come back in 3 weeks, in a month. Patient, how quickly do these come back in your particular case?
I really haven't noticed it.
Okay.
Take a note of it, but this time I will.
Okay. It's probably I suspect a couple of weeks. Right, and what I always recommend, in addition to this, is the use of a urea-based cream, ammonium lactate, anything to kind of keep it at bay.
You said cream?
Yep. And for the diabetic patients, I do not recommend the use of a pumice for obvious reasons. If the patient is neuropathic by mistake, right? Mm-hmm. They don't feel. Okay. And I would highly recommend that family members do not get involved. Hey, can you do me a favor? Next thing you know, it's a bloody mess. So what I'm doing, I'm just palpating the areas where I think I can take a little bit more around the periphery, especially like up here.
I'm sure it probably has something to do with the way I walk also.
Oh no, this is, I mean, there's no question that between biomechanics, like I was saying before, biomechanics, structure equals symptom. And this is basically, you know, this is the deepest part right in the middle. Okay? That's where the quote-unquote, the core, right? This is the core. And we'll kind of just smooth that out a little bit there. Well, Dr. Wagner, why didn't you take the whole thing out? Because right there, all we have to do is by mistake break the skin barrier, and next thing you know, the bone is hanging out of the foot. Exactly. Oh man is right. Okay, so we're gonna kind of leave it there. This is really nice. Feels good. We don't need to do this here. Okay, let's go to the other side. To a lesser extent, obviously the patient must have some type of a limb length discrepancy. To exaggerate, patients kind of like this, putting more weight on the right than on the left. Okay.
I have never noticed it, but I will.
The callus never lies.
So it's on the left?
That's on the right. You're
I'm sorry, I'm pointing to the right and saying left because you're working on the left, I think. Yeah, this one.
Oh, well, Dr. Wagner, why are you using a 10 blade today? You usually use a 15. I don't know. It's easier to just put it there. Doesn't really matter as long as we get the job done efficiently and effectively, right?
Right.
People find an element of therapy while they're watching these videos, but it does also bring an element of therapy for myself. It's very relaxing. Everything we do, I think, is relaxing, especially when you like what you do, when you love what you do. See, this one's a lot. Come on here. Very, very careful. Very mindful. Okay, let's go back here. Almost there. But without a doubt, we do have a lot of patients of all walks of life that come here because of the notorious pinch callus. Yep. For aesthetic reasons, believe it or not. Okay. And also for functional reasons, pain relief. So there are a lot of solutions. A lot of solutions out there. Super. Nice and soft.
Oh.
I shouldn't. This is the new look.
No, I'm sorry.
The corny pants.
Mm.
Or the corny scrubs.
When you stand into that, it's on the floor.
Super. That's gonna feel a whole lot better.
It does.
Even already, right?
Yes.
You've lost maybe a couple of pounds.
Yeah.
Good, 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 good.
Oh, yes.
Happy patient, happy doctor, happy feet. As always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Ladies and gentlemen, always a friendly reminder, we are not out of the woods yet. Please wear your masks. Stay safe.